Amanda. I'm a nursing student from Macomb. I'm here to perform a physical assessment. It shouldn't take any longer than 20 minutes. This is going to involve me touching your head, your chest, back, abdomen, arms, and legs. Is that okay?
Yeah.
Okay, I'm going to start by verifying your ID. Can you tell me your name and date of birth?
Rachel Melosi, 9/25/93.
Excellent. I'm going to ask you a couple questions regarding your orientation. Can you repeat your name for me?
Rachel,
Can you tell me where you are?
school,
Can you tell me what day it is?
Wednesday,
And can you tell me why you're here?
for the exam.
ANO times 4. I'm looking at the patient's posture. Her posture is upright, her hygiene is appropriate, her clothes are clean, her hair is brushed. Did you have any trouble walking in today?
Nope.
And how are you feeling?
I feel good.
Excellent. I'm looking at the patient's skull. The contour is round and symmetric. Hair is brown and in a ponytail. It's evenly distributed. I'm going to palpate your scalp. Any tenderness?
No.
Scalp is non-tender, no lesions, no dandruff. I'm going to ask you to do a couple facial expressions for me. Can you smile? Can you clench your teeth? Can you wrinkle your forehead? Close your eyes tightly. Puff out your cheeks and stick out your tongue. Okay, facial movements are symmetrical. Now I'm moving on to the patient's face. Her skin is intact. Facial and bony structures are appropriate size and intact. I don't see any deformities. No lesions, no scarring. I'm going to palpate your face. Any tenderness?
No.
Skin is smooth and non-tender. I'm going to palpate your sinuses. Any tenderness?
No.
Sinuses are non-tender. I'm going to ask you to close your eyes again. I'm going to touch a few places on your face. Just point to where I touch. Excellent. Now I'm moving on to the patient's eyes. At this point, I would perform a Snellen and Rosenbaum exam. Her eyebrows are thin, hair is evenly distributed, the skin underneath them is intact. She's exhibiting normal blinking. Her eyelids are intact. Eyelashes are present on her upper and lower eyelids. Go like this for me. Conjunctiva is pink, no discharge. You can let go. Sclera is white with little veins. Her irises are brown and round. I'm going to test your pupil reaction. Just look at me. Go like this. All right. Focus on my pen and then look at the wall behind me. Okay. Pupils are equal, round, reactive to light with accommodation and consensual reaction. I'm going to ask you to focus on my pen. Just follow my pen with your eyes. Do not move your head. Excellent. Now I'm moving on to the patient's ears. She has 2 ears. The skin is intact. Looking at the external auditory canal, there's no discharge. No lesions. I'm going to palpate your ears. Any pain?
No.
Ears are non-tender, no lesions. I'm looking at the skin where the lymph nodes are located. I don't notice any edema, urethria, or red streaks. I'm going to ask you to close your eyes. I'm going to do a couple tests. Close your eyes. Let me know when you hear my fingers
I hear
rubbing.
it.
Excellent. We're going to do a Weber's test. Let me know if the vibrations are equal on both sides.
Equal on both sides.
Excellent. Now I'm going to be moving down to the patient's nose. The skin is intact. It is midline and symmetrical. No deformities, no lesions. Go like this for me. Good patency. I'm going to look up your nose. Turbinates are pink. No discharge. Moving down to the patient's lips. The skin is intact and pink and moist. Open your mouth for me. I'm looking in the patient's mouth. She has the appropriate amount of teeth. They are white, good oral hygiene. Her hard and soft palates are intact and pink. Uvula is midline, no redness in the back of the throat. You can close your mouth. Tongue is pink and slightly rough and glistening. I don't notice any abnormal odors in your mouth. Anterior and posterior pillars are present in pink. I'm going to test a couple range of motion exercises of your tongue. Stick out your tongue, move it up, down, left, right. Tongue has good range of motion. At this point, I would palpate the gums and tongue and elicit the gag reflex. I'm going to test for TMJ. Open your jaw, close, positive TMJ. I'm moving down to the patient's neck. Her neck is symmetrical. Trachea is midline and alignment is appropriate. I don't see any goiter or thyroid bulges. I'm going to check carotid pulse. Carotid pulse is strong and equal on both sides, +2. I'm going to ask you to lay down. We're going to check jugular distension. Look away from me. Good. Negative jugular distension. All right, I'm going to have you sit back up. All right, we're moving on to the arms. Patient has 2 arms. The skin is intact and they are both symmetrical. I don't see any deformities or lesions. Any tenderness? Nope. Arms are non-tender. Temperature is warm and equal bilaterally. I'm going to check a few pulses. Radial pulse is strong, +2. Brachial pulse is strong, +2. Palpating epitrochlear lymph nodes. Any tenderness? Nope. Epitrochlear lymph nodes are non-tender, non-palpable. I'm going to test a reflex in your hands. Relax your hands for me. Good brachoradial reflex. We're going to do a couple range of motion exercises. I'm going to have you stick out your hands like this, move your fingers apart, go like this, roll your wrists, lift some weights, shrug your shoulders, and I'm going to check your range of motion in your neck. Push against my hand, shrug against my hands. Good. Good range of motion in the neck and arms. Moving down to the hands. Patient has 2 hands. They are symmetric. Skin is intact. No lesions, no deformities, no excess moisture. Nails are round and clean, non-brittle. Capillary refill is instant. Go like this for me. Negative finger clubbing. All right. We're going to move on to the posterior chest. Looking at the patient's chest, the skin is intact. No deformities, no lesions. Her scapula and spine are aligned. I don't notice any dyspnea. I'm going to feel down your back. Any pain?
No.
Non-tender. I'm going to ask you to say 99 each time I place my hands on your back.
99, 99, 99, 99.
Equal fremitus vibrations. Take a deep breath for me. Equal thoracic expansion. I'm going to press your kidneys. Any tenderness?
No.
A non-tender on CVA percussion. I'm going to listen to some lung sounds now. Lung sounds are clear. I'm going to ask you to interlace your fingers and put your hands on your head, checking your lateral lung sounds. Deep breath. Okay, lateral lung sounds are clear. Moving on to the front of the chest. Our patient has good and equal muscular development. Her posture is upright. I don't notice any pulsations or heaving, no dyspnea. Each time I place my hands on your chest, say 99.
99, 99, 99,
Lift your breast for me.
99.
Good fremitus vibrations. PMI is strong, +2. I'm going to listen for some lung sounds. Take a deep breath. Lift your breast for me. Your lung sounds. Next, I'm going to listen for your heart sounds. We have aortic, pulmonic, Herb's point, tricuspid, and we have mitral. S1 and S2 audible, S3 and S4 inaudible, no murmurs are noted. I'm going to ask you to lay down. We're going to check your abdomen. I'm looking at the patient's abdomen, contour is flat, skin is intact, no peristalsis or pulsations are visible. She has a tattoo on her right hip and a belly button ring. I'm going to listen for your bowel sounds. Bowel sounds present in all four quadrants. I'm going to listen for bruits. We have aortic, renal, iliac, and I'll defer for moral. I'm going to lightly palpate your abdomen. Let me know if you feel any tenderness. Any tenderness?
No.
Non-tender, no bulges, no masses. I'm going to ask you to raise your head. I'm going to palpate your umbilical area. No umbilical hernia. Did you have any neck pain when you raised your head?
Nope.
Negative Brzezinski. You can put your shirt down. At this point, I would palpate the inguinal region for femoral pulse, lymph nodes, and any bulges that would be associated with hernia. None would be present. I'm going to check for Kernig sign. I'm going to raise your leg. Let me know if you have any neck or back pain. Any pain?
Nope.
Negative Kernigs. Now I'm looking at the patient's legs. Legs are symmetrical. The skin is intact. Her legs are shaved. No varicose veins. No lesions or scarring. I'm going to feel your legs. Any pain?
Nope.
Non-tender. Checking temperature. Temperature is warm and equal bilaterally. I'm going to check a couple pulses. We have your pedal pulse, posterior tibial pulse. Those are strong, +2. I'm going to have you flip onto your stomach for me. We're going to check your popliteal pulse. Popliteal pulse, +2 and +2. Excellent. I'm going to have you sit at the edge of the bed. We're going to check a reflex on your patella. Just relax your legs. Good patellar reflex. Patient didn't have any trouble going from the lying to the sitting position. I'm going to ask you to stand up. Go ahead and bend over for me and touch your toes. Patient has good spine alignment. All right, I'm going to ask you to take a couple steps that way and come back towards me. Patient's gait is well coordinated and balanced. We're going to do a quick Romberg test. I'm going to ask you to put your feet shoulder width apart. Close your eyes. Negative Rombergs. And our final test is going to be just assessing your fine motor functioning. I'm going to ask you to make a T with your arms, close your eyes, and touch the tip of your nose with your index finger. Good. Patient demonstrates fine motor functioning. That concludes our physical assessment.
Thank you.
Mm-hmm.